nó kín đen của đất cả bốn ngày nát nè. Tít mà, tít. Dạ, nó rất là bớt. Nó rất ngon thế, rất ngon thế. Ba.
Everybody has to enter and they will be had before they come to be taken the temperature. We are screening all of them. If somebody has a high temperature, then the person is going to be seen for testing for COVID. So every patient who is entering, every visitor, every patient who is entering the hospital has to be taken the temperature.
Bar?
Kujala all gan dan terde. Kujala all TV. TV je phải. Kunai là nó vẫn ghiền. Asan baru coin. Uban thế gì? Wah ni. Uban thế gì? Uban là nó. Dia nó. Nah, kita nhom lah. Kebijakan lagi, ni tak wei ni kita lah lah itu.
Cái cô phải
báo cáo với người dân đến qua lâu chứ bác cũng mua nhà đâu lá của liệt thì cả cái nó thì nhà nó chỉ mua thế đủ cũng mua đấy cái gì là thế
em đang cái chip lá
đấy em đang có bữa nay cũng nữa lúc thế có nhà nó có buồn cái ngủ thế này để chốt
nếu như cái
Sao thì nhỏ đi nào gọi không? Thôi gì nữa? Kia rồi. Chẳng những cái đây
Marvat.
We are having a crisis of the COVID-19 and we are testing COVID-19 in Gordhim. So this is a tent for the resting place for the people who have already been diagnosed to have COVID before the government comes and picks them to take them to Awiro for Right House for the admission there. So by the time we call the government or the people who are concerned, the Right House people, to come and pick the patient, this is the resting place for the COVID-19 patients. The just where we are giving drugs for TB every morning we call it DOTS. Some are coming from home. As you can see, the number is big. Some come from home every morning. They stay with their relatives, and then they come in the morning to pick the drugs. We are only admitting the patients who are very, very sick in the ward, who are critically ill. The rest, they are just coming from home in the morning and to take the drugs, and then they go back. Then tomorrow morning they will come back and take the drugs every day. Now, before we go ahead, we shall invite the one who is giving health education. Gabriel Makoch is giving health education today. He can give health education and tell us what he has for us for today.
To TB patients. And all TB patients, others, they don't know English language. So now I'm going to use a mother tongue. To use a mother tongue, kabatij la kena wan te liaptin itwan wol en ki ta chite chak tieng aswar ka e te ye o twan yokti twan wol itwan ko ben be te man corona ke TV ay yo kala to woli ran to bawal ka yiki to kum te man chi to kum kan apat man chi to kum kala apat kudun cha kuma to kan eno kai gel twan wol yen twan wol la chi pinya ngok kan tin ayom churo bianya ta tin ko che ta lai chuba ko che ta lai man alir tin bu aga ti aga rut bena duin wala bu kai kai tia aga dede pinya che ngok edede ko ja che wol karan ki to kum inda ngwan ake ko liap tin ka ngwan ko ja liap ko ja che ro duin ha duin le ko che ro duin ngudia tia gi ko che ga yi tia bu ko rel group ko no bu ko chira mel ha ko ja che ro duin pinya che ko yal du pinya ngok du ran ti pin ngok lom aga de di pa ha no wi ne ma chi ya du ke ran ga ko ki to kum yal tin bi ka de no ya pi ni ti ti ran ti ngok tin ke luang pal wa tin yal tin ki ne ku ti ko nya ba chi lo yu ka diak wala ka let us say ka diak eh le ran ngi ki deri tin betie ha ran ngi ki deri tin oya ko ni ap ko
ya kote ka je fio jo kiti ko lia sen TV wal kara yitia kara ki to ko ale varalia tin pingok ko pinyangok varan tin ale budiang lia ka ai chi garo ban tia uwe fresh broda lo tin ka ali so ki lia tin ten kaka ake process chi o fio buka di chan lang di chuo lang chuo lia bu tuan bu protected so in color kan
kon ko
en ka je pya jo ka chi wo yo ya ka tuan ge chi ta ni ji nen ke chi lia du pe ngo ka yi lia man ko ke lia ka la en ta wali ka le ko bai to ko bu man ko ya ke lia ko chi lia kan ka le mo dia ka ja che ro de tia ang ba ro tia karan tin bu tuan ka cha la lia jala pio ja ko le ja ka ji pia ka le ba pandu wala pio ku ba na ke du do man matin ya bu tuan.
This is the place where we screen TB patients. Others they are diagnosis and others they are follow-up, or let me say others they are presumptive and others are follow-up. Those who are already admitted and they need now to follow up their treatment. So we usually send them back to laboratory for sputum check-up. Then after that we give drug after the result. Now, here is one of the patients which we need now to give TB drug, because sometimes we can receive a lot of patients, sometimes we can receive few patients according to the number which has visited the facility. Like today now, I can estimate we have 20 or even, yes, we have 20 patients, which we have.
Aku jam malam tu mit kau mit terkait tu ada. Punya lagu mit terpoji dia jakol. Kuat mit tu ada. Ayo lighting radio ikut ping. Alice facility ikut ping ya ini lah kau. Tengok kau cari lah kau kau ikut. Ek lepas jalan mit lazim jangan dia lakukan. Unang kuat kinutan kecil lebih kuat kuat pilih kuat kuat pun. Ulah cile bela nyumi dan pilih jangan kecil kuat. So we can be at work all the time. Jambu pialu, jambu ten jambu ada hal. To go ten, kena makin kur muman. Dalam mana lemi tiket to elong. So mi tiket to elong kain ke jami ti, in ke mandu in ke tuat. But the sini mit, kamandu sini jambu kangar tuat. Because like the tongue again, cuma wing elwel tu kian yo dapat, ya nak tu. Ulah mandai pina tan ikin ke tuat manuwe. Kau lam tan ke human being, tan keran ben, kau lewe tan te cium ke mudwe. Mi dah on quest kami kulitin ke lebih gatuat. So we tu be amit mi dah on quest. Kakak cekek lihat pin kakak lagi ke jadi payah lagi je. Irat giring tu lah mi team ni manga. Cuma ni mi kokaret, mi te kakak on mi team kau ke cam ni banana ke kai ke cam. So mana tu team ke cam tu tan lazim cam bawa batial. Job ya pial gu de job female pregnant mothers like ting chip ting ngu jila ting chip ting that ko wi cham ba ben hal facility cham bu ba tin dal mandu na wone to ya jirel ka da because me de lon ka ya ke rel ti ya na len ke me de ro riu ti ya ko len ke det na cho en ka me de le cham ya chok ke kong ve en ke le di en ke ne le ka luong ka na ko len ke de me de ro chok pin bi an bia mo men bo so ka chi da ka o ya bu party to bu ke ting ya cuma we marka ka baga ben facility kwen kin chiwe tingin na chak ting tingin na ke kai tingin ke na doctor we na jam ke doctor belage no da awi ba ben facility ya ne ke lu ke na visit tan ka pender le pender cuma na shin ben ko lin dia ga ko pen di ka ko lin dia ko na to mi ben pana kim chan bin ben non ting ay ting da le ke ya na lawan so me den wi u ban a ting den ki so na ji ting ki dia to um ki chol immunization tiga de chen ke jit kami dia topping beren into position chak ting mun tin tinga de jit ko chitoj go me go tau de yai tan kulegen ke tuat ke lam ko lazum cham wa dia pana kim da but bi me da tuat tin ul te bi ne na chopping din cham ba ti ken tin chu ting mun tin ne chu chopping tan ke yen ti so ke ang le bi la ko le cham bi le yi tin ten ko le bi la num si le bi la to ko den e ko cha chen ne ko ta ba da le cham ba ta during the first 6 months, zaman pai ka datum during the first call. Wala yu par kuni madu do chi lebo kang yege ni pi. So ene no during the first 6 months medicine ki lebo kang yege. E wan mudia, e wa tamu ajin mandu kamandu ko uben ke manore mandu uben ke chidor. So we jin be a chang tin ke yege starting from this the person dia di ake ke chitken lai loy ting di de le uben ke piu ku ke tung wonder ula be ke yin nyan de ku le ku chan ba man ge chan ba moy piu bu de kwen tin chua ga ting mun tin pi chi ting ke no che chin lo kala bu ko den ai chi ting di de ye piu ku le la ku be ke ye mandu ku de la me moy kun ke ki pai ga tung ke ga ke tung kala zum bu ban ke chi dor kin ten kwen we yo mi ko ga a ben ke chi dor wan ngu de ke ga ke ga moy piu ko yi bela we ya kula kwan man tin ko po di lazum chan be ya to te ja so wi ba to mun tin to den commander mệt ya chỉ quan ấy ya biao ya cái ya thôi tính ra là uy cũng mệt càng biao này biao cái nó cái đó là cái thôi đó cái chỉ là uy bala ya thôi thì tung biao cũng được cũng mệt bala cái này nhau during the first 6 months also wala meat caro wala meat okay you know we go so I chatting on that man can achieve that a chiban came and not you lay in a chidor in numero de dum chanti which is like that you got it the achieving that we know we mali water Kujala lam kaye na ke kwen to kro kuja kuman kudi betara hitipa so ladum dinge pa cha buke ga kwa da pa buke ti mo ayu je piu kujala ko chan bu me du ba ge do ti man ke so man ti do ya ten ku jo de ro bu cho ga ni wang ni tu na ko bo ba dia ku ye na yue ma lo ku na ko me ke yue ko bo ba dia ye nya re ke ti nywan fo ye nya che fu ye cho ge bisa una bisa yen ke na te yen te yin lo ke ya ka man ku ben ge dol kala bu ko len tin ke ko chen kamit ban me do wi be a fa di chen man ken ko man ken chwa so kwen man wi ku ken ku na ku me twet ka bu dai ke wa a cha tin na ke tin ke me ka ti ke wa man ken lu wa chup long ti man ken wel chup long so yen ke na mi da bu ya ye ko ba te ko te ya yen ku ko man da le bi ja ku tu den la kin te ra kin ke ko di ku ta ke ro to ka le bu ke lo ke da so le buke deng kire se ko chi le bijai ke buko mi da che ya to man da le bijai ko de ko cha tin nan ke ting ke mi da won ke mi da won ko cha tin nan ke ting ke man de ja mo ko ga mi da won en ko lai ko lu du lai re je le cham bu wi tin ta ku te ba ta wi to ko chi wi ja na cho ka ku ni de ko la na de ko chen kin ke ku la wo ko chan bi ya cham kun tin chi wo tin man kan ma tin chi na a chi am mu de Because they are trying to make back in the town, I live with Chala, and then something to kill you. But James, did you?
Maybe they have put a lot.
Yo try yo ben na ki na tena na pen pa na be nya ji ke be mi ko ben ko ke je nya ru ya ben ba ni twen ni ko ku ya lu ni ka ri ke ku twen ko ben
We urge PCPM to provide us with some nutrition equipment in order for us to take exactly the things we assess the malnutrition cases in a proper.
Our eye in the community and tell us how the program is having an impact in community. How do the community say about this program of PCPM, of the way the children they are benefiting with the parameters? So he must have heard there in the community what the community says about the program. So I will come in to talk about the program there outside the community and whether the program is benefiting the children around the area. My name is Catherine, in charge of the Gordhim PHCC. Now, what I want to say is Gordhim Hospital is running a lot of programs. We have TB and HIV program, we have leprosy program, we are doing an outpatient program and the inpatient in OPD who have general diseases like pneumonia or malaria. And we also have pediatric, where we have one clinical officer who is dealing with the children. We also have antenatal care and immunization in this hospital. We are doing laboratory work. We are testing TB, we test malaria, we are also testing COVID-19. And I think we are very lucky in Awilo East. We are the only people in Gordhim who have the machine for testing the COVID-19. Up to this time, we are doing well in all the programs as we join one and as the integration program. From here where we have reached, in outpatient, we have screened 397 children, that is below 5 years. We have seen 1,142 adults, that is above 5 years, and this one has been done up to last Friday of of date 30th of April 2021. We have done antenatal care, antenatal visit of women who have seen, that is 137. We have immunized 120 children. Deliveries have been 4. And we have done health education to the people in outpatient and the pregnant women and children 500. And in children in a screening of malnutrition. Right now the malnutrition is still, we are not yet in the hunger gap, as the number is still low, but we are expecting a lot of number to come when the hunger gap reaches. Maybe from June, July there, the children will start coming who are very malnutrition. But up to now, from now up to now, we have screened 406, and 75 have been yellow, and 26 have been red. So at least we have done a great job, though the malnutrition children, they are still coming. With this juncture, I would thank AAA, and also I thank the PCPM for making this program well and beautiful. And I also request the PCPM to be adding prep-nuts. As the hunger gap comes, we are expecting more children. We request them to buy for us at least more prep-nuts than what they have done, but we appreciate what they have done. We have challenges of which are facing us in the facility. We have human resource, which is less. And if human resource is less, I think the work cannot go on well. So if there is somewhere where we can have extended human resource, we would appreciate. We have a challenge of drugs. As the community in the other facilities, they are charging. There is cost sharing in the other facilities. Here in Gordhim, we don't have any cost sharing. And we are only depending with the drugs, small drugs AAA is buying us through PCPM, and also the smaller drugs the government is giving us. So we are requesting the PCPM if they can add us some money for buying the drugs in order to make our facility better than before. And especially the drugs for seeing other 5. It is very, very important for us, and we would really appreciate. We have a challenge of water, as our sources got broken some time back, and we are also requesting if there is any donor who can come up and buy for us the solar, because the pump is still underground, but the pump cannot pump us water without the power. So we are requesting if there is a donor somewhere who can just uplift himself and give us some funds to buy the solar, then we would run our running water in the taps, and would really appreciate. Up to this juncture, I would just thank PCPM. We know what we have done. It is because of them, in conjunction with the AAA. So we thank all of them for joining hands together. I also thank my staffs, as the work they have done is a great job, and they work tirelessly without non-stop. So I would request the people who are here working in the nutrition, they come here, we take a photo, in order for us to show that really we are together in serving this community. You tell them when they are